Hi guys, coming to you from a very rainy, dreary day here in Florida. This is another one of my live and unedited videos answering questions that I get from you guys. And I absolutely love engaging with you guys this way. I love knowing that the things that we talk about are really making a difference in your lives. So thank you for all the emails and comments I've been receiving. It's really humbling to be involved in your healing journeys the way that I have been. So the question, the $1 million question that I get asked by literally every patient I've ever worked with in my life is, how long is it going to take me to get better? When is my chronic dizziness going to get better? And like every other medical professional you may have asked this question to, I'm going to give you the most annoying answer in existence. And the answer is, it depends. But I promise I'm going to give you a little bit more than that now. I'm going to explain a little bit more about some of the factors that we should take into consideration when thinking about how long it might take you to recover, what recovery even means, and some of the factors that I've seen on my own, in my own experience in clinical practice, that seem to affect most how quickly people start to feel better. So to start with, I want to mention that I see a huge range of recovery times. I've had some patients walk in, I talk to them about what chronic dizziness means, and I teach them parasympathetic breathing, and boom, they call me the next day and they say I'm cured. It's fantastic. That doesn't happen for most people, but that does happen. So sometimes the timeline is very short, whereas for other people, especially those who have a medical contribution to their symptoms, like vestibular migraines or Meniere's, because they have episodes that lead to fluctuations in their symptoms or their symptoms going up and down, it can be a little bit more of a journey. And I've had patients who I'm still working with a year later. Now, I do want to say though, they always get better. There is always a trajectory of getting better. What getting better means though depends on the person. So I'm not even just talking about the end point, whether that means having no dizziness at all or having just a baseline dizziness that's acceptable. I'm talking about the trajectory, the timeline during which they start to notice differences during their daily activities and the extent to which they're able to participate more fully in activities of daily living and activities that they enjoy. So that varies based on the person, but we always see progress. There is always some way to help you. Always, 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 always. So I want to talk a little bit more about the things, again, that I see personally that tend to most dramatically affect people's recoveries. One of them is how long that person has been dizzy. And there's not always a one-to-one relationship with this one. I've had people who've had really long-term dizziness get better very quickly. And I've had people who've very recently developed dizziness not get better as quickly. But in general, when you've had more time to practice being dizzy, because dizziness is kind of like a muscle, your brain practices being dizzy, and the more it practices being dizzy, the better it gets at it. The longer you've had to do that, the stronger the muscle is, the more ingrained that neurological pattern is, the stronger the neural pathways. In other words, that dizziness muscle that's in your brain, the longer you've been flexing it, the more swole it is, okay? And when that happens, it's harder to get it to stop, all right? It's harder to get it to relax, loosen up, and stop engaging as frequently as it is. So something to take into consideration, but by no means saying that if you've had dizziness for a long time that you can't get better or that it's going to take longer. It's just something that may affect how quickly you get better in the long run. To me, though, the biggest factor that affects how quickly people get better is how much that person buys in to the idea that what we're dealing with chronic dizziness is a neural circuit issue or a brain pattern issue rather than a physical medical issue, the way that physical medical issues are normally defined. And I'm not saying that it's all in your head. We've said this in other videos many times. All experiences are always in your head, okay? And also, if you have a physical condition like Meniere's and migraines, you do have a medical condition that's contributing to the episodes of dizziness you're having. But if you're having chronic dizziness, dizziness between episodes or dizziness without any episodes, depending on what kind of condition you have, then what we're dealing with is a misfiring pattern in the brain. The brain is not firing correctly. It has a bad program. It has a dizziness muscle. It's flexing. Okay. So if someone buys into that idea and they understand that idea and they say, yeah, I totally get it and I see how that applies to me, then it's a much easier process to start to overwrite that circuit. If you are firmly convinced that the only person who can help you is a medical physician and that something needs to be cut out or operated on, then when someone can't cut it out or operate on it, you can get stuck a lot more easily than someone who understands that they have agency in their healing process. So if you've already been following my channel, chances are you buy into this idea that your brain circuits are affecting your symptoms. So you've already set yourself on the path to recovery. Going back to what I was saying earlier about the trajectory of healing. So some people, again, get better super fast, symptoms are gone. Other people take a lot longer. What I can tell you is that people always get better. Now, is it going to be the type of better that lets you go back to all the things that you love to do right away? Not necessarily. It can take a while, and I have no idea how long that's going to be because it depends on your individual brain and a lot of other factors in your lives. For example, if you're under a ton of external stress, that's going to affect your recovery. If people around you aren't supportive, that's going to affect your recovery. There are many factors that we've discussed in other videos that can affect how quickly you can change your brain, and as well as just genetic or individual factors. That said, when I work with people one-on-one, especially, one of my big jobs is to help them see progress, help them notice and see progress so that they keep going, because it's not easy. This is not easy work. So one of the things that people tend to notice first is that when they do a particular exercise, it doesn't make them dizzy for quite as long, okay? They may not notice any differences in their baseline dizziness. They may not notice any differences in their responses, their dizziness responses or symptoms in response to activities of daily life. But what they will notice is in response to very specific activities that we work on, they'll notice that they're not getting dizzy for quite as long, or that the intensity is not quite as strong. And the longer they go practicing these various activities, these various exercises, they start to notice that the brain is adapting and just the dizziness muscle isn't flexing as hard, and that intensity and duration of the symptoms tends to go down. That's the first thing people notice. The other thing that is a huge, huge positive indicator that we are on the path to recovery is being able to control your symptoms with grounding. So the biggest technique that I use in my practice and my work with people is parasympathetic breathing. And we've talked about this before. I have a video on it, and I'll have more videos on it because I talk about it so much. But parasympathetic breathing and other grounding techniques control the nervous system. And once you figure out the way that you can control your nervous system's response to things, and you realize that you have control over that volume dial, that dizziness volume dial, that is an absolute game changer, because then it enables you to start trying more and more challenging activities and exercises to adapt to. And once you do that, we are able to start building in activities that simulate or even are some of the most challenging activities that you can't do when you are symptomatic. I hope that gave you some idea of what the trajectory of healing looks like and how long it might take. Although, again, I think this was mostly a fancy way of saying it depends, but your journey is your own journey. We don't know how long it'll take, but again, I just want to reassure you, people will get better. We don't have control over the pace, but you will get better. Thank you guys again so much for joining me. I hope this was helpful. And again, I love engaging with you this way. So please continue to ask me these fantastic questions, and I'll keep making little live videos like this in the rain in Florida. All right. I'll talk to you soon, guys.